In this video, I'm going to talk about different forms of renal stones and then the treatment options that are available. So the other term for renal stones is nephrolithiasis, and then the low fluid intake is generally the most common cause of renal stone development. And then the most common site of stone impaction is the ureterovesicular junction. So if here we have the kidney, and then via the ureter it connects to the bladder, and here we have the urethra, then here is the ureterovesicular junction where you most commonly will find the renal stones. So there are 4 types of stones, which include the calcium stones, and calcium stones account for 80% of all the forms of nephrolithiasis, but then calcium stones are also divided into 2 types: calcium oxalate, which is more common than calcium phosphate. The other forms of renal stones include uric acid stones, struvites, and then cystine stones, which I'm going to discuss each one of them next. So calcium stones are most common causes of renal stone development, and common causes of calcium stones include hypercalciuria. For instance, if the patient is hyperparathyroidism, then they can develop excess amount of calcium in the urine, which can cause renal stone development, or hyperoxaluria. And common causes of oxaluria include, for instance, the citric acid abuse, ethylene glycol ingestion, as well as ileal resection, which enhances the absorption of oxalate. And so these patients can be treated with thiazide diuretics, and what thiazide diuretics do is that they decrease renal excretion of calcium, and thus by having less calcium in the urine, there would be decreased chance of calcium stone development in these patients. The next form of renal stones is the struvite, also known as staghorn calculi, which occurs in patients that have urinary tract infection with urease positive organisms such as Proteus, Staphylococcus, as well as Klebsiella. So what these organisms do is that they will break down urea into ammonia, which is making the urine basic, and then ammonia combines with the magnesium and phosphate to form these struvite stones. So for the treatment of these patients, you will have to remove the staghorn renal stone via the surgery and then give antibiotics to eradicate infectious agents in these patients. The next form of renal stones are uric acid stones, which are commonly seen in patients with hyperuricemia. And conditions that can cause hyperuricemia, for instance, include gout, as well as patients with leukemia who undergo the chemotherapy, and thus due to the high cellular destruction, there is an increased purine release from dying cells, which can cause hyperuricemia. Also, acidic urine is another cause of uric acid development, so acidic urine. And so the treatment of these patients include hydration, as well as the alkalization of the urine. And alkalization of the urine can be done by potassium bicarbonate. And then the final form of renal stones are cystine stones, which are caused by the cystinuria, and the crystals have a hexagon-shaped structure. And for treatment of these patients, you have to again provide hydration and alkalization of the urine. Now, in terms of the clinical presentation of these patients, the 2 important clinical symptoms are pain as well as the hematuria. So pain, it depends on where the stone is being located. So if the stone is in the upper ureter, or if it's in the renal pelvis, then these patients will present with a flank pain. On the other hand, if the stone is lodged in the lower ureter, like for instance in the ureterovesicular junction, then these patients present with a pain that radiates to genitalia. For the diagnosis of these patients, you can use ultrasound or CT scan of the abdomen without contrast dye. So if you give these patients contrast dye, the contrast dye will cover the stone and you won't be able to see the stone anymore. So once you're doing a CT scan of these patients, you must make sure that you do not provide a contrast dye. Another example where you should not provide a contrast dye is patients that have head trauma. And so if you're looking for a possibility of hemorrhage, or in patients with a stroke that you're looking for a possibility of hemorrhagic stroke, again, you should not provide a dye in those patients because that would interfere with the visualization of the blood. So in any case, the radiologic test that can be used to detect renal stones is a CT scan of the abdomen without contrast or ultrasound. X-ray is not really a good tool for detecting renal stones, and the reason for that is that X-ray can miss small stones, and also it cannot detect the radiolucent stones, which is characteristic of uric acid stones. So the way you can memorize it is that uric acid stones are radiolucent. So uric acid stones are radiolucent and cannot be detected by an X-ray. So generally, for the treatment of patients with renal stones, you will have to provide IV hydration and pain management by either providing ketorolac or morphine. So stones that are less than 5 millimeter are usually passed by their own. However, by increased size, there is a progressive decrease chance of passing the stone by itself. And stones that are more than 10 millimeter are usually unlikely to pass, and you will have to consult a urologist for possible interventions. Now, the medications that you can use to enhance passage of stones include tamsulosin and calcium channel blockers like nifedipine, which will relax renal smooth muscles, and thus they would enhance the passage of stones. And after stones are passed, if the patient could save them, then they have to be sent for analysis to determine what type of stone that is, and then treat the underlying cause. And that concludes our discussion.